Hi friends, welcome back to allornonelaw. This is a surgery, a clinical vignette. Here I am going to give you the case history and you have to tell me the diagnosis, next best step and the management. These videos are really very important for USMLE step 2 CK. Okay guys, the clinical vignette starts here. Okay, let's talk about a 28-year-old man was stabbed in his right chest. He was stabbed in the right chest. Okay. Now he complains of shortness of breath. Vitals are stable. Vitals unstable. On examination, no breath sounds. No breath sounds. At the right base, where there is an injury, there is no breath sounds, and only faint, distant breath sounds at the apex. And when you percuss, it's a dull to percussion. So what's the diagnosis? Tell me. Of course, it's a hemothorax. So you took chest X-ray, and it confirms a hemothorax. So it's not the end of the vignette. I'm gonna talk about later. I'm talking. Now what happens? A chest tube is placed. You start placing a chest tube. Okay, at the what you call appropriate position. That's the right pleural base. And now you get the draining of the blood is a 120 ml. Okay, and in another next hour it drains only 15 ml. Next hour. So initially you get 120 ml and next hour you got 15 ml. That's it. So now tell me, what do you want to do? That's a really very good question, right? So remember over here, the important point is the hemothorax. It all depends what you want to do. It depends on the blood, the draining of the blood, the amount of blood. Okay, if it's a more than, some says 1000 ml, some says 1500 ml, if more, then you have to do thoracotomy and ligate the arteries. Why? Because this severe bleeding is not from the lungs, it's from the major what you call systemic pulmonary arteries or pulmonary circuit. Okay, that's why you have to ligate. That's really very important. So here you're getting a small amount, that's 120 ml, and the next hour you got only 15 ml. So it's improving, and it's what you call it's a very low amount of blood. So what you have to do is just keep quiet, nothing to be done. Okay, everything is okay. Okay, and it subsides on its own, right? Yes, and this, remember, the important point for USMLE is lung injuries. Lung injury, that's, I'm not talking about the chest injury, I'm talking about the lung injury. They will subside by own. Okay, so most of the time they don't require any treatment. Okay, so here what do you want to do? Leave it. No need to do any exploratory surgery. That's it. So leave it. It's gonna be improved. It's gonna be, everything will be normal. Okay guys, so this is about the clinical vignette. I think you understood the basic concept. The basic concept is that it depends on the amount of blood draining. If it's more than 1000 or 1500, do thoracotomy and ligate it. Okay, if it's a very small amount, means it is from the lungs. If it's a more, it's from a pulmonary circuit, or if it's, sometimes it can be more from what you call from the intercostal arteries. Okay, but it will not be more than 1000 or 1500 ml, but it will be around the 600 ml in 6 hours or something like that. Okay, so let's talk in a separate clinical vignette. Thank you so much for watching this video. Take care.